Well, let's start by thinking about outcomes in general. There are many different outcomes of hospitalization. First, we'd like to have the patient go home happy, healthy, back to their families, in as good a shape as is medically possible. But to get to that point, we as clinicians tend to think about outcomes that are process-centered or care-centered. In other words, have we got the glucose controlled? Do we have nutrition restored? Do we have the heart rhythm controlled? Those are things that are important to us as clinicians because they contribute to the outcome. But that's not what patients and families are most interested in. Patients and families want to be together to enjoy life as best as they can and hopefully better than they were enjoying it before the hospitalization occurred in the first place. One of the challenges we faced is that up until a few years ago, we really didn't think about ICU care after the patient left the ICU. We weren't aware of, we weren't cognizant of, we weren't attuned to the consequences, the long-term consequences of critical care on our patients and families. Patients often don't remember their stay in the ICU, and that's a wonderful thing. We have various medications which leaves much of their time in the ICU blank. Families, on the other hand, tend to remember a great deal of it. So one of the most important things that we've learned is that it's not just patient-centered outcomes, it's patient and family-centered outcomes. And we clinicians have started to realize that we are managing a unit. For families, we have learned that the sometimes difficult, occasionally terrifying experiences in the ICU linger with them. Part of that is the sleep deprivation of having caregivers come in and out of the room, the various alarms that ring constantly that they don't understand, the fact that often families feel disenfranchised and powerless to participate and support their loved one during the stay in the ICU. Think about what we used to say to families. Rounding in progress, families do not enter. What kind of message was that sending to our families about what the medical team was doing for and with their loved ones? Of course, we did the same thing in obstetrics. Fathers were kept in the waiting room while deliveries were going on. Obstetrics was ahead of us. They realized that birthing was a family event, and now new fathers are welcomed into the delivery room. We're making that same type of progress in our care of families in the ICU.
We were fortunate enough to get our first national grant from the Agency for Healthcare Research and Quality this past year, which is termed Project Dispatch, and that's an acronym that was formulated from really disseminating patient-centered outcomes research to healthcare professionals. The types of patient-centered outcomes research that Project Dispatch is targeting to highlight includes a couple different areas. We're looking at patient and family-centered research. We're looking at what are some evidence-based strategies to improve care for patients and families. SCCM has a long-standing history of really providing resources and education, so we're going to be evaluating the impact of different educational strategies. This grant is very important because although clinicians have access to research, one of the difficulties is that oftentimes we don't have the time to integrate that into clinical practice. So one of the goals of Project Dispatch is really trying to promote integration of patient-centered outcomes research. So sharing best practices, sharing ways that members are integrating families and family-centered care, looking at integrating family presence during resuscitation or during invasive procedures. We have many international members among SCCM as well, and some of those individual countries are struggling with such things as open visitation for families. So how to integrate patient and family-centered care, and what might be some strategies to do that at the bedside.
Project Dispatch is helping SCCM members, the care community at large, and even our families and patients in the lay community understand that what matters to patients is their health long after they leave the ICU. By combining information, evidence-based, peer-reviewed, reliable information on how we improve the patient-centered outcomes, health, wellness, strength, mobility, activities of daily life, and presenting them through Project Dispatch to our caregiving communities, we are offering them immediate access to reliable information to improve the lives of those we serve. There's so many aspects to patient-centered care and patient-centered outcomes that are so important. It would be difficult to highlight one over another. But here are a few things that have interested me. First, we know that critical illness and critical care cause patients to become weak, helpless, and with that causes great psychosocial distress for them. Programs that aim at early mobilization, at reducing the amount of medications we give that sedate the patient, to more engage them in their recovery. We've learned that that leads not only to faster improvement, better outcomes, but also reduces the actual costs of their care. And that's what's so exciting about it, because as we look at the triple aim of healthcare in this nation, of better care leading to better health and lower cost, these types of patient-centered research projects and the knowledge that emerges from them and the opportunity to disseminate that knowledge is going to achieve that aim in a way that's going to make patients and families and the entire care team much more satisfied with their experience. The tagline for the Society of Critical Care Medicine is right care, right now. That's been something that has driven our members to higher and higher levels of performance. We need to add one more couplet to that. We need to deliver the right care right now, and we need to do it every time. And in order to do that, we have to know the research, we have to know the evidence, and we have to commit to a consistent standard practice so that we can say to every patient, to every family member, to every person who is going to come to each of our units, we are giving you the best care today. And what we learn from that best care today is going to lead to better care tomorrow.